So hello, and I want to welcome you to today's webinar. It's titled Leading with Respect, Standard Work for Frontline Leaders. I'm Mark Graven. I'm going to be your host and moderator today. And we have two presenters. I'll introduce them a little bit more fully in a minute, but they are Didier Rubino from Value Capture and Jen Ashley from Sutter Health. So thank you for joining us, and thank you everyone for being here. So first off, Didier Rubino, he currently serves as a client advisor for Value Capture, guiding healthcare organizations in their lean transformations. His prior responsibilities included 8 years as a lean sensei for Health East and Fairview, 8 years at Anderson Windows, where he led the development of the Anderson management system and also served as a plant manager. Didier also spent 13 years at Steelcase, where he started his career with various operations leadership responsibilities and supported the development of the Steelcase production system. And we're also joined today by Jen Ashley. She holds a bachelor's degree and is a care center site supervisor for practice design for Sutter Health. She joined Sutter Valley Medical Foundation in 2008, and her Sutter career path started as a patient service representative. Then she moved into a patient service coordinator role and is now leading a team on innovation for practice design and in-person patient flow. So welcome again to both of you, Didier and Jen. I will hand things over to you.
All right, thank you. Okay, so I'm going to just talk a little bit about Sutter Health. Sutter Health is a not-for-profit healthcare system, and we're headquarters in Sacramento, California. And we strive to enhance the well-being of people in our communities we serve through our commitment to compassion and excellence in healthcare services. We were founded in 1921 in a response to a flu pandemic in 1918. Kind of sounds familiar. And we're composed of hospitals, hundreds of clinics, thousands of physicians, clinicians, nurses, and employees. And our key results here at Sutter Health is that we deliver healthcare that is safe, personal, affordable, and accessible.
Value Capture, we are a trusted advisory group that was founded in 2005 under the helm of Paul O'Neill. Our mission is to partner with healthcare organization, healthcare executives in order to capture all the value possible from the patient, the staff, and the community. Our vision is to create model sites for healthcare, and we are still working hard at that so that we can inspire others to close the gap on perfect care. Our goal is to develop capabilities, creating culture of continuous improvement. And we come from multiple backgrounds or from different industries, and together we are trying to help the healthcare systems and healthcare organizations like Sutter Health.
Okay, so today's webinar, our learning objectives are going to be going over explaining the frontline leader role and responsibilities. The intent of this webinar is not to show you a piece of paper. It's not going to go over a leader standard work checklist. The purpose of this is to define the processes and tools that you need to support the frontline standard work. We're going to be going over what truly matters and what you're trying to achieve as leaders, and how do you bring your team alongside you to meet your goals.
So Jen and I worked together for a year in near Sacramento, and we are going to present you. I'm really excited to be with Jen today again, even if we are a few thousand miles apart. But we are going to present to you the concept, and Jen will present some of the ways the concept was applied. So the first note is understanding, okay, what is, as a frontline leader, what matters most? What is the most important thing? And really, if you simplify it, it's to make frontline employees successful 100% of the time in doing the work, executing the standardized work, and challenging their standardized work. So we have a part that is, how do we support the frontline employees so they are successful, and how do we support them to improve or challenge them to improve the work. So some of the so where do we start? We start with establishing the process standard work. So what is the best way to do the work? So we support the frontline employees to identify first the key processes, those that are the critical processes to meet the customer needs. Identify how do we measure the outcomes of these processes? If we don't measure the outcomes, we don't know if they are met, and we have no way to improve or to know if the improvements are going to work. And so to do that, we help frontline employees designing their standardized work. So we call that the participative approach. So how do they do the work? How do they design the work in order to achieve these outcomes, considering safety, of course, but also quality, ease to learn, and the efficiency in doing the work. So how many motions, how many, the number of times that employees have to think about doing the work. So we simplify it. And after that, we teach this standardized work using some of the tools that Jen will present.
Yeah. So like Didier was saying, the first step is to identify your key processes in your care center. The purpose of identifying those and creating standard work for these items is a couple of reasons. One, you want your staff to know that they're doing the job right, correct, or wrong. And secondly, you want your customers, your patients, to have the same quality and care and experience each time they come in. So once you identify your processes, then you identify what the expected outcomes you want. An example for my care centers is inmate rooming. That is a key performance indicator that I have identified. And you can see here on this slide, the top left corner, we're kind of at high level identified what is expected to come out of that. I'm looking for an agreement from my patient and my MA to come together to agree on what we're talking about and what's going to be addressed today. We also expect that the vitals are collected, and we also expect that the MA is pulling and identified outstanding health maintenance items that's needed for the patient. Once you've established what you want out of the outcomes of these processes or jobs, then you create your standard work. And how we do that is we use a job instruction breakdown. And it's broken up to 3 sections. The first is a high level. It's what's the important step? What is it? What are we doing? Then we break that step down to key points. What are the key points that are needed to be done to complete that step? And then we go into the why. Why is it important to do it that way? What's the safety need? What's the quality need? What is the importance of handling it the way we have it addressed in the standard work? This helps break down the process for the staff when they're learning. So alongside with this tool, we use a teaching method called a job instruction method, and it breaks down each step. The first step, you actually get your employee to understand why we're here, why we're learning this. We try to understand where they're at, what they already know about the process, and we get them excited about to learn about this process. From there, we go over each step. We tell them the step, and we show them the step one by one, and we're continuing to repeat the key points to it. From there, we then have the trainee do the job. They then teach the trainer, and the trainer then creates any errors they may see as there. And it's important that the trainee can explain each step of the process that identifies that they're understanding what they're learning. Then you let them on their own. Then you identify a help chain if they need help, or you identify the help chain if they need help, and then you also encourage questions. Questions are helping them understand the process fully, and they can also teach it back. And this is something that you do frequently, and you constantly follow up with the employee.
So Jen presented you the method that we used to teach. That is a pretty old method. It's I think it started in 1943 when the War Commission used it for prior to World War II, but it is still very effective in healthcare. So the intent is to make sure that we've taught. So we usually say that if a learner hasn't learned, it's because the teacher hasn't taught. And so we train the number of employees that we need in order to fulfill the customer needs. But defining the standardized work and teaching the standardized work is not enough in order to guarantee that the customer needs are going to be met. So we need to make sure that we enable the standardized work to occur. So how do we do that? We need to validate that when we start the day, we have all of the necessary information, the tools, the equipment, the material, everything is ready to be used and available in order to be able to conduct or to do this standardized work and meet the customer needs. And during the day, the frontline leader will provide feedback, reinforcing or corrective feedback. So the standardized work is just an hypothesis, and we want to validate if this hypothesis is continuously validated.
Okay, so here we have a couple pictures here. The bottom left-hand corner is a timetable, and this is a tool to help you with your training. It's to help you get organized and to have that follow-up. You identify your employees and then the date you started training them and then the follow-up. Are you following up the next day, then a week, a month? This helps you kind of get organized and have a cadence scheduled. And the goal of this is to have everyone have the knowledge and skills to be successful in their job. From there, we go to the picture of the top left-hand corner, and that's a training metrics. And this is a tool to use to identify the capabilities that your staff have. So you'll know what level of training or skills they have in each job. And this helps me as a leader. So if I were to have a call out and I have a gap now in my staffing, I know who I can pull to fill that gap, who has the capability to take on that role to fill it in for me. Then here at the last picture is a picture of my stand-up board. Every morning I pull together my team, and this is the people doing the work, the MAs, the front desk, my leads, and also clinicians. We come together and talk about our patient demand for the day. What does it look like? How are we going to win the day? So we're identifying the customer demand. We're also identifying the equipment we need to meet that demand. And we also identify any barriers that we can foresee. Maybe we have something that's broken, that's not working. What's our current workaround? Are we pulling from another care center? How can we pull it early so we can continue flow? It's what we do as a team to prepare and make a plan for the day.
So now that we have established the standardized work and enable people to do the work and make sure that they have everything that they need in order to do this standardized work, we are going to have a frontline leader to support this standardized work during the day. And that means the frontline leader is going to confirm that the standardized work is conducted, is done. No, we say inspect what you expect, and people will respect what you expect. That's a nice tongue twister. Try to do that 5 times, and we use the help chain in real time in order to remove obstacles to standardized work. So we need to expect the unexpected again, because there will be some issues. All the standardized work is not always going to be able to be followed, because there will be an IT issue, because there will be a supply that is not available, or there will be a situation that the standardized work doesn't cover something that is new, and the frontline leader is a first line of defense in order to support the people who to do the standardized work, to follow the standardized work, the best practice.
Yeah. So like what Didier was saying, we want to inspect what we expect so it's respected. I'm a true believer in that. If my leadership's not coming to look at something, I don't know if they value it. Do I truly need to follow it? And I don't understand why I have to do it, right? So I truly believe in that slogan. But one way you want to organize yourself as a leader is to have a cadence schedule to be confirming these standard of work. So confirming, auditing, same thing, right? You want to make sure that the confirmation's still up to date. Not the confirmation, standard work is up to date. And we also may want to make sure that our staff have all the skills and the tools they need to follow that standard work. So a couple ways you can organize yourself. There's one on the top left-hand corner. It is a confirmation table. Here you can list your key performance indicators, and then you identify for that month what days you're going to be confirming that. You have a schedule there. You have each the 4 weeks and then by day on there, and you can identify by initials if it's going to be you, a lead, or a high performer in your care center that's going to be helping with that confirmation. Again, you can set the cadence to be weekly, monthly, whatever you feel is the need. Another way you could organize yourself is I have a process observation calendar, and that's the picture in the middle of the screen here. And this is what I currently use in my care center. Here it's the month, and there's pockets in there. And throughout the month, I have Kamishibai cards assigned to a day, and that's identifying what standard work I'll be confirming that day. And it tells me where to get the standard work and what care center. I have multiple care centers. From there, I then, once I do the standard work, I come back and I put it red or green based on the outcome. But once I identified what standard work I'm going to be confirming, I then pull out my management tool here of standard work. So higher level of the steps of the standard work, as you can remember the previous slide, the standard work gets very detailed. And that's very hard as a leader to be confirming, to be watching every step and the employee and up and down on the form. So I like to use this tool because it breaks it down a high level, each step that you're expecting to see. And then beside that, there's actually a map. It's a map of my exam room, and I can see where in the exam room that employee should be when they're completing that task. So there I can quickly be going up and down and watching the employee. Once I'm done with the confirmation, I give real-time feedback to that employee. I let them know what went well, what barriers I saw, ask them if they had any questions as well, and give that feedback. From there, I then bring it back to my board, and I actually have a process observation record, and that's where I record red or green. What was the outcome of that? Were we able to follow it? Was the standard work up to date? Depending on how it goes, I then again identify red or green and the date I did the confirmation. Then I can see a trend of what's happening. After that, I then, if there's an action needed, if it's red, then I identify the action and assign ownership. So identify what's needed, who will be doing it, and the date it should be done by. I'll let you know with COVID, there's been a lot of new guidelines and things like that that's been pushed for Setter, and I love this process because it's then I'm able to tie it back into my standard work. Many times I've been red the past few months is because I have not tied that in, and gives me the opportunity to update that and then make sure my staff has the correct tools and standards they need to be following.
So the standardized work is not something that is static. The conditions change, and and by inspecting what we expect, we can advise on potential changes in order to keep the standardized work actual. So Jen talked about supporting standardized work by observing, by identifying potential gaps, and what we want to do is maintain the flow of the work. So with Lean, one of the things that we care for is the employees. We want to make the frontline employee, capable to do quality outputs, provide quality output, and the role of a frontline leader is to maintain the flow. So we have a quality responsibility on the frontline employees, and the flow, the responsibility for the quality of the flow is on the frontline leader. And very often we see these roles being in reverse, which creates some issues. So maintain the flow of the work. What does it mean? So Jen mentioned recording some problems, what prevented employees from doing the work. And what we want to do is, problems are precious. We want to collect these problems and use every problem to as an opportunity to stabilize and improve the flow of the work, and also in fact, every problem as an opportunity to learn how to solve problems. So we are going to identify the causes that generated these problems. We want to identify the causes as soon as possible, because information is perishable. The more time the longer you wait, and the less effective your identification of the point of cause, of the root cause, will be effective, and therefore the countermeasures will not be as good as you want them to be. And you may solve the same problems every single day. So we want to identify the causes that generated the problems, and we're going to use visual signals so that everybody can see them, and visual metrics in order to identify, if possible, potential issues in real time and before they become really problems.
Yeah. So like Didi was saying, so not only in supporting the standard work, we also need to be maintaining the flow of our work in real time. So an example, in my care center, we have in-baskets. And this is a virtual in-basket where our patients are either calling our call center and sending messages in, or using our My Health Online and sending messages in. So this is also customer demand. We have the face-to-face customer demand that's happening, and we also have the virtual customer demand. And so we need to keep a pulse on that as well. We got to be able to maintain that flow as well as a team. So one thing we have in our care centers is a visual board that we update frequently on the in-basket numbers. And it's broken down to providers, to the MA baskets, and to by individual folders. And here, anyone in our care center walking through will know if we're winning or losing. Where are we at? Do we need to change gears? Do we need to move people to work on different baskets? You don't see in this picture here, but next to this board, there's an established base on customer demand and staff. So with my leadership or without, it's very clear if we're in the red and what we need to do. How many staff or how many providers, if we need to adjust, need to move gears and help a certain folder out to bring the numbers down to be back in green. Here it just keeps it, again, a pulse on it, and we know what we're doing with our virtual patients and what the pulse look like. Another thing we do to collect in real time, this is a great example. It is very simple. I just get a flip chart and I post it on my care centers on the wall. So when there is a disruption that happens, anyone, again, staff or providers or leadership that visually sees it happens or experiences that it happens can then go write down the problem and the cause. We want to get the details of the cause in real time so we don't forget everything. And it's important to capture it. So again, these are just on the walls, and you can just grab a pen and jot that down. You don't have to have a solution. We really just want you to speak up about problems, because problems make us better and they help us grow. And so with that, we encourage staff and providers to talk about and bring it up and have a tool to express and talk about it.
So, I'd like to go back to the clinician in basket, Jen, but, this is kind of interesting because we have some information that is in our system, IT system, but you have someone who is writing this information on a visual board. So it's like, well, that is waste. However, what we noticed when we, at the beginning, when we were trying to identify are we in flow or not in flow, we will ask the people working on the in-basket, so are you on track or not on track? And some people with 10 messages will say, oh, I'm on track. And other people with 200 messages say, oh, yes, I am on track. So there was no really, okay, what is expected and what is, and also it's, there were situations say, well, people hesitate asking for help.
Yes.
And we made this very transparent, say, hey, no, this is when we are at this level, the help is going to come. So you don't even have to ask for help. The board is going to tell us that you need help and we're going to help you. Correct?
Correct. Yeah.
So we have, we maintain the flow, we identify problems, and we want to treat problems again as a way to solidify our processes. So at the end of the day, what we'll be doing, at the beginning of the day, we made sure that we had everything ready in order to win the day. So it was a bit of the planning session. At the end of the day, we're going to check and reflect. So we're going to use a stand-down meeting in order to review with the team the problems that we encounter during the day, because not everybody can see the problems. So we are going to share, but other people may have experienced the same problems. And we are going to engage the team members to analyze the reasons for these problems and maybe engage some of the teams or some of the team members to get down to the root cause analysis if that has not been done already, and implement or at least test hypotheses or countermeasures and validate their effectiveness. So beginning of the day, we plan for the day, we run the day during the day, and at the end of the day, we're going to do a check and adjust. So why are we doing that in this situation at the end of the day? Because we tend to forget things. And at the end of the day, we have a fresh information, and you can see a lot of engagement from the team to say, okay, hey, these are the problems that I had today, or this is what prevented me from doing my work. Let's talk about that. What could we do?
Right. Yeah, like what Didi was talking about, we do a stand down each day to reflect of what worked and what didn't. And it's very important to have everyone on the team together. You're having your MAs, your front desk, leadership, and your clinicians there as a team. First thing you do is establish professional safety. You want everyone to feel comfortable to talk about their experiences. We're talking about the processes and not the people. And everyone needs to have a voice. We work as a team. We can't do the job without one another. So it's really important to establish that professional safety each time. From there, we then go over, I review the standard work confirmation I did that day. So earlier in the day, I did it with that one individual employee, and then I bring it to the whole team. And we talk about it, and we can all learn from it. And then after that, I then will reflect on the day, what worked and what didn't. We will talk about what barriers we may have had and maybe think of some quick fixes. We'll also then review the flip charts that we had posted in the care center. And depending on the magnitude of the problem, we will then assign ownership to take it offline. And with my coaching, we will get to the root of the problem and come up with a countermeasurement to experiment with. Or it might be just a quick fix. It might be something that we want to do a quick change, start it tomorrow, let's experiment and see what the outcome is. So it just varies.
So we talked about problems. There are also opportunities. So the difference between a problem and an opportunity is a problem is you want to go back to the standard, and the opportunity is we want to raise the standard. So make the standard work more effective, easier to learn, provide a higher sense of safety, better quality, etc. Or maybe adapt to new situations. So we are going to engage the employees in order to challenge their standardized work. We are going to support the employees in experimenting and implementing ideas, hypotheses, and we are going to recognize the efforts, and we will share with other teams and spread the success. And here we close the loop of from looking at helping, supporting people to do their work, and challenging them to improve their work.
Yeah. So after I've identified an owner to take on a problem to get to the root, I will help coach them through that. And these are some of the tools that we use. The first one is the top left-hand corner. It's a simplified A3. It's broken down into 4 quadrants. It's to help us get to the root of the problem. And it's broken down to defining the concern, the problem, the cause of the problem, the 5 whys, kind of get to the bottom of it, and then coming up with countermeasurements that we want to take on. And then on there, we have a checklist. We identify what actions need to be done and define ownership and due dates for that. And this sheet here lives on our wall. It's visible. Anyone coming to the care center can come through and see what problems that we're currently working on and what the status is. So it moves throughout these different sections of the wall, from when we pull pull a sheet, we identify the date and the problem, and then we're either working on it in the care center or we maybe escalated it. There's times that we need to escalate and cross over because we have to pull other resources or expertise that maybe it's pulling from, such as maybe another department or a specialty that we need to help us get to the root. So again, these are displayed on the wall here, and then when it's closed, it's moved into a folder there. From there, it then goes to a system to share. So as items are closed and we've done experiments and they worked, we want to share, right? We don't want to have people to do the same work again and do that rework. So we use a system to share, and it's very basic. We just use a Excel spreadsheet, simple. But what we like about this is that everyone has access to this in the organization. So we identify the problem and the countermeasure that worked, and we share standard work or pictures, whatever we need to do. So when leaderships go in there, for instance, for myself, I will go in there daily and see what's happened the past 24 hours in my organization, see what problems came up and what solutions worked. And then if that's something that I have in my care center, I can then just pull that into my care center, those learnings, and share and spread. It's a quick way to spread learnings throughout the organization. From there, the last picture I have here is our book of knowledge. And this captures all our little A3s that we have completed. It's kind of a book of honor for our care team. So we can show new staff coming through so they understand the culture in our care centers and how we work our problems, and also visitors that come through as well. It's a great way to kind of look back and see the growth we've done all together as well.
Yeah, it's a little bit ceremonial when you put, your completed 4 quadrant into the book. You have a sense of accomplishment, and the Excel spreadsheet is not as visible. It's good to spread across sites that are not, next to you, but for the team seeing, okay, this is what we've done. This is what we have done in order to improve our work. That is pretty good. So this is the end of our presentation in terms of how do we lead with respect using Frontline Leader Standard Work. Jen and I and many other people work together to improve primary care in Auburn, California. There's a possibility to learn more about the work that we've done by downloading a white paper that we did together on the Value Capture website. So if you are welcome to download this document, and it's a lot more than Frontline standardized work. It's how do we drive for zero in terms of safety issues, quality issues, and zero wait time, etc. So how do we drive toward the theoretical limits of the true north? If you have more questions, you can email us. So there is an email address, or you can visit us at valuecapturellc.com.
All right. Thank you, Didier and Jen. And if you can go back briefly, Didier, I want to make sure everyone sees that there's a white paper that's available as a free download at valuecapturellc.com/Sutter. So a few other announcements before we get into Q&A, and I'm glad we have a lot of time. Nobody ever complains that there was too much Q&A, so I'm glad that we can take advantage of that here. I want to let you know about a special offer. So one project I've been involved in with Value Capture is the publication recently of this book. It's called A Playbook for Habitual Excellence. It's been available as a free PDF, but it's also available through the Kindle store. And this week through Friday the 18th, it is free through the Kindle store. So those of you who read Kindle books, you get the ease of it downloading directly to your app or your device. So I'd encourage you, not now, but right after the webinar, go to Amazon. You can go to valuecapturellc.com/playbook. There is a lot of wisdom from some collected speeches of the late Paul O'Neill that I think you'll find to be very interesting, very, very inspiring. So I want to make sure you know about that. Our upcoming webinars. If you are a KaiNexus customer, our next training team office hours is being held September 24th with Adam Darnell and Matt Bana. And then our next webinar is actually going to be a panel discussion. This is open to everybody, so we hope you will register for this. We're going to have a panel discussion called How Lean and CI Help You Get More Nimble and Adaptive in a Pandemic and Beyond. So we're going to be joined, he's wearing a mask in the photo there, but Dr. Greg Jacobson, our CEO here at KaiNexus, Skip Stewart, Dr. John Toussaint, and I'll be moderating that panel. So you can register right after this session by going to kainexus.com/webinars. If this is the first time you're joining us on a KaiNexus webinar, you can access our entire webinar on demand library. That's all free. You can find that at kainexus.com/webinars as well. We have a blog at blog.kainexus.com. And I also want to tell you about our podcast. And the audio from today's webinar is there, will be there in the podcast feed. You can learn more at kainexus.com/podcasts. You can subscribe through Apple Podcasts, Google Podcasts, Stitcher, Spotify. We ask you, please subscribe and rate and review. That would really help us out a lot, the KaiNexus Continuous Improvement Podcast. And so with that, here is everybody's contact info, and we have questions. So can you first elaborate a little bit? You mentioned the phrase point of cause. Can you talk a little bit more about what you mean by point of cause and then what the root cause is?
Yes. So the point of cause is that, in fact, before doing a 5 why analysis, to identify the root cause, you need to know where or when the problem occurred. So because very often the problem discovery is further downstream than where the problem was created. So we want to first identify where or when the problem happened in the process. So what is the point of cause? And from there, when we identify where the problem was created, we can drill down to the 5 why. So let's not jump to the 5 why as soon as we see a problem. We need to understand first where it originated.
Jen, anything you want to add about that from your experience of getting better at understanding the point of cause as you do problem solving?
Yeah, as a leader, I've had many people come up to you and tell you problems, and it's very generalized, and it's very hard to get to root of a problem if it's very generalized. So what I like to tell my staff, when this happens next, you need to tell me right then, pull me, and let's get to the root of that individual problem, because it could take you to so many different levels and it gets so big sometimes. So if you really get specific to what the problem is in real time and you know what really happened, maybe your environment or an employee involved, it could help you break down to the actual root, and it could solve that one and maybe not have to ever happen again. Or if it happens again, then there's another avenue. But there's just such a importance to be very specific about the problem and catching it in real time.
Yeah. Thanks. A question here talking about Gemba time. Is the standard really 100%, or is it whatever is required to ensure 100% success? So I think just adding on to that, how do you decide how much time is sufficient out in the workplace as a leader?
It really does depend on my day, but I do try to actually strive to be mobile. Something new I am starting with my lead is actually getting mobile carts with our computers and just be in the middle of the Gemba, be in the middle of your care center, helping and being supportive and hearing what's going on and jumping in when needed. Can that happen all the time? No, and that's fine. But you have support. You have your lead, or maybe a high performer, someone that could help, be a substitute when you're not currently in there. Again, I have multiple care centers, so I can't be in all 3 of them, but I definitely strive to be in person as much as I can. And that's all you can ask, really.
The purpose is to have someone, because things are going, plans are never, going to be. You are never going to have a day with where the standardized work is going to be executed perfectly at every single cycle for everybody. Right. So, what is the response mechanism? What is the help chain that will support the employee who is trying to follow the standardized work? That's the key. I would say the extreme will be when you look at progressive line. I know some progressive lines where signals are answered within 2 to 3 seconds. That is when you have very small, very short takt time of around 15, 20 seconds. So you cannot miss, you cannot wait for 5 hours in order to have a response. You cannot even wait for minutes. So here it's okay, how fast do we want to be when a problem is going to happen? And what is the support mechanism that we need to put in place? So the employee is supported, because what matters is the work to be done and what is the structure that we put in place to guarantee that the value is going to be provided following safety, quality, etc.
Got another question here. Jen, do you maintain the visuals, or is that part of your standard work to make sure that they're maintained?
The visuals, like thinking of the in-basket, I'm guessing, that type of stuff. Those.
Maybe Thomas can follow up with
if
there was a specific, but yeah, I mean, I think of the different boards and tracking sheets that you shared.
Yeah, so, I mean, let's talk about that. So we can talk about the confirmation tables and also the actions that are needed after that. Yes, whoever is, so it's myself and my lead right now that are responsible to do those confirmations of the standard work. And then we come back onto that board and document what the outcome was it red or green, and what the outcome is. Now, depending on what the action is, it could be something I take on or my lead, or it could be someone else. It could be a high performer that I give that action to. It's really open to what the task is. And so I do maintain that part with my lead as my assist helping me with that. The other visual boards that we're talking about, the stand-ups, stand-downs, and also the in-baskets, that is a team approach. I do expect that staff can come in and plug in either their customer demand for that provider, they're kind of task that for themselves. If someone's putting a ticket in for a broken equipment, they're the one going on the board and updating the board. So there is that ownership that everyone has their part to put in there. And then we also assign for in-basket. Right now, it's not automatic or electronic. So unfortunately, we are manually putting that up there. So that is someone assigned to that. I do help with support with that a lot, but at the same time, I can also assign people depending on what my staff is, what my staff ratio is.
Yeah.
But yeah.
So a couple questions about the stand down times. One is how long is that and how often? I think I heard daily, but wanted to confirm.
Yeah, definitely daily. We want to reflect, and I encourage my staff, if there's times I'm in meetings with or without me, it's important to talk about that day. And so daily, and you really want to make it quick. I strive for 5 minutes. Sometimes it's about 5 to 10 minutes is where I want to have the max. And I put a timer on there to be aware of the time. So we set a timer, let that go off so we're aware of the time. It's really not a time to problem solve. It's really to do some reflections and then take things offline if we need to set the team to look at it further. So that's the hard part. You really need to steer your team because they want to go talk about solutions and take it off into this whole process on digging deep at that time, and that's just not the time to do it. The people that are very involved with it, I pull off site and I make time to work with them out of that stand down to get to the root of it.
Yeah, and Didier, do you have anything to add on that, or the general question about how long huddles or stand ups or stand downs should be?
Yeah, I think Jen answered perfectly. What is also interesting is maybe the dynamic aspect of a board. But the standard, it's not on day one, but your standard and your visuals are going to be perfect. In fact, they will never be. So that's maybe something to think about. We start by what is the purpose? So we are not doing some market shopping of best boards in the area and try to copy them. We try to really understand what does the team need in order to be successful, and what does the team need to know in order to reflect and adjust, so that we lead with purpose. And after it's you can see that, like Tom mentioned, it's everything is handwritten because it's dynamic, and you want to also give this perception that it's always a draft. It's an evolving draft. So there's a psychological aspect to it. It could be, nice is different than good. What we are trying to have is not a good board, a nice board. It's a good board, an effective board.
Right. I'm going to add something on there too. Sorry. The importance of having stand downs and your stand ups every day. It's that consistency. So I just can't strive, especially when you're starting to learn this and bring your team aboard. You have to bring that consistency. You have to repeat that, professional safety and establishing that. And the more you do that, the more routine and comfortable people feel to share or talk about their experiences. So I strongly say daily is very important, definitely to bring that culture around and to where people can talk about problems and come up with solutions and work together.
Yeah. So speaking of solutions and working together, there's another question here that asks, and ballpark answers might be the best answer for this, but what percentage of improvement comes from the stand down reflections versus other sources, times when people just identify opportunities for improvement?
Of course.
Might be hard to answer.
Yeah, I don't know.
Because maybe asked a different way. The stand down meeting is not the only time or venue or mechanism for generating ideas.
Correct. Yeah, we're not pulling a lot of ideas during the stand down. It's very little for those quick fixes or changes. It may be that we implemented an experiment for that day and we want to do a little adjustment, and we can talk about that, the stand down. A big majority is taking outside of that. So I would say about 90% we're trying to take it outside that stand down. I want to be respectful, or even maybe higher than that, respectful of the time. We're doing this at the end of the day, yet we're still doing patient care. So it's very important that we respect everyone's time. And also we still have our patient demand coming through and trying to end our day. So that's key. That is key.
If I may add, at the end of the day, what we are trying to have is the feedback of a process, especially some of the metrics that the individual team members may not see. So, for example, what was the wait time for the patients? So we can look at the performance of the process. How many, what was our performance in terms of satisfying the health maintenance? So the team can reflect or say, hey, we had this issue. So we are looking at the outcome of the processes rather than catching the problems during the day. So it's a different type of problems that we'll be looking at the end of the day. At the end of the day, we're going to say, hey, did we win? And if we didn't win on all of the areas, what prevented us from winning, and what can we do next day or next week in order to do a better job at planning or a better job at executing?
There's a couple questions I'm going to sort of stitch together here. Do you perform the 5 why root cause process within the stand downs, and do you schedule specific times for problem solving during the day?
Yeah, it's not done in the stand downs. Again, that takes some time. And sometimes you need to go investigate the actual area or where the incident happened. So it's scheduled time, and that's something I usually work with that employee about what's a good time on their schedule that we can meet or pull people together, get coverage, whatever is needed. Sometimes they're even done in between patients. It just kind of depends on where we can fit it in, but it is not a time during the stand down.
There's another question here for Jen. How long did it take you to establish the system to the point that it works? And I guess works, that's always I mean, it depends on what you mean by works. Works well enough. It's not perfect, as you've emphasized, and that's fine. But how long did it take to get this up and running?
Oh my goodness, months. It takes a long time. It's definitely change management involved. I definitely had staff, clinicians not understanding why we're doing this. What's the importance of this? And so again, it's that consistency. And I would say weeks, months. I mean, I would say a good month or two of being consistent with the stand downs and stand ups, but then people start seeing the value pretty fast. It's just them coming. That's my hard part sometimes of seeing, what squeeze in their schedule, because I'm not blocking schedules for this. So it's having them come in the moment at that time and bringing everything together. So I think that's the hard part, is bringing people to the board at times. But once they're there and they're seeing that things are being moved and evolving, then they see the value. I've had clinicians even ask, why do we have department meetings and we go in a conference room when all our information's here on the board? We're already doing it. So that was what's really exciting. We were able to do things in real time, and they don't see that importance of that once a month meeting in a conference room without all this information. We're solving problems in real time now. So it took some time, but I would just say the consistency and using recognition is what helps you.
So there's, you're talking about recognition. Maybe this ties into a different question. How do you maintain enthusiasm within the team to continue committing to attending meetings, stand downs, participating this way?
Yeah, it's that recognition. It's exciting for those. It's getting excited for those little wins, and just encouraging people to continue to bring up problems. I think every person that brings up a problem, because even if it was a near miss, you may have saved someone from getting hurt, or a patient of delayed care, things like that. So again, I'm constantly thanking them for bringing them up, using that recognition, and celebrating the wins. Even if it's a little improvement, that's a win, and we need to be excited about that and continue to work on them. So that's what I do.
And teams like to win. That's so. And there are so many teams in healthcare or any industry that they go back home without knowing they had won the game or lost the game. And I think there's a lot of energy when you see the score, when you know what is driving the score, and when you have an opportunity to influence the score. So imagine if you were to go to the NBA, the 7 games of the NBA final, and there's no scoreboard. That would be a very boring, situation. You don't have a clue who is winning. Just see people passing the ball from one end to the other. And unfortunately, this is what many frontline teams feel. They don't have a clue if they are winning or losing, and what they can do about that. So I think this is what is driving a lot of energy in the teams in order to know if they are winning and what they can do.
Yeah, there's a game 7 today, the LA Clippers and the Denver Nuggets. You don't want to say, say the clock is going down, like, I feel like we're winning.
Yeah.
When you're really down by 12.
Yeah.
Exactly.
So I have another question here, not basketball related. Sorry. Do you, when it comes to standard work, do you ever include actual photos that correspond with the steps in the standard work process so the operator can help visualize what they're doing? And then second question, have you ever recorded people doing the work so that they can go back and help review?
Great. Yes. Photos. Absolutely. I think that's huge. I'm actually really big with photos. I know the slide I had here did not have that, but it's very important for the visual part, especially when we're talking about elements maybe in our computers or Epic. We use as our database for our charts, and there's so much to look at, right? So when we talk about click on something, so yes, pictures are key to be able to help direct people to know what you're looking at and what you're talking about. I have not done the recording. I think that's a great idea. I never thought of that. I think recording's important, but Also doing it in real time and understanding what the trainee is capturing and not capturing. You don't want to lose that. That's the only thing with that recording. You're going to lose that touch. So it's a good idea, but I think if you were to do that, you still need to follow up with that hands-on training to know what they're understanding and not understanding.
We still have more questions here. So there's another question. Jen and Didier, of course, feel free to jump in if you have thoughts to add. But Jen, as a manager, where did you struggle most when standing up this system, and what helped you to overcome that?
Standing up the system. I think the biggest thing was getting the providers to understand the importance of this. That was the first. I mean, my staff, they follow me. They'll do what I ask. They're really great. They understand the why, the importance. They've been doing it. But when it was the time to okay, providers, you need to be joining with us. We're a team too. We work together. It was, well, why do I need to do this? You guys just talk about lunches. No, we're not just talking about lunches. We're talking about the patients coming in. It's more than that. And so that was probably one of my biggest challenges, again, because I was not going to be blocking schedules, but still influencing them to come and join us. So just, again, being consistent, rounding 5 minutes before our huddles, either our stand-ups or stand-downs, and reminding them and asking them if they have a moment to join the board was the most important part. So just being consistent and bringing them, and when they come, just influencing the value. So talking about it, and I celebrated and thanked them when they did join us and when they gave us feedback. That was also, that we consider that a win. We got a provider that joined us and gave us some feedback, and then they saw their value because they would hear staff talk, but then they would bring another aspect in there, and then they were starting to realize how we all work together and how it's important. And once that starts clicking, then you start to see them showing up on their own, which is exciting. But that was definitely my biggest challenge, is how do I get my providers to see the value in this? But once they do, then they definitely grab on, which is great.
And I think, Jen, it's also thinking about the professional safety and the psychological safety. So we are focusing on the process, and it's not there's nobody who is put on the hotspot and in a difficult situation. So it's so that everybody can feel free to speak up. Is also a change management that takes time. So you have a couple of people who are always talking. They always feel safe, and little by little, other ones are going to trickle and start to be engaged, and we'll see that it is safe to speak up, and it is expected, in fact.
Yeah, that is correct.
Yeah. So let's see, maybe a final question here, because you talked about value and explaining the value to physicians or other stakeholders. Maybe just elaborate as a good wrap up here. How would you explain the value of using these visual boards and that stand down time? Somebody knew nothing about it, and they say, well, why should we do this? What are the gains and the benefits we would expect?
You're reflecting on their day in real time. You have the day currently, you just experienced it. You can talk about more details of what happened. And that's key. I feel a lot of times people, again, you have that once a month meeting and you're talking in generalized, you're not talking specifics. So having specifics and documenting what experiments did change and very detailed is key. It's definitely key.
Didier, any kind of final general?
Well, I was going to ask another question to Jen. What would happen if you were to stop doing it?
I would lose, I would hope my staff would continue if I stop. I think they would. I truly do feel they feel this. I truly hear them express the importance of this. So I feel even if I were to stop, they would continue. But it was a lot of work. It was a lot of work. And I just feel so honored to have such a great team to work with, that we grew together. And now looking back at where we're at, it's just great. So I would hate to lose all that. Yeah.
So Mark, like we said before, so there's a white paper that is available. So Jen and I worked on this white paper, so it is available at valleycatcherllc.com. So please go there and download the free white paper to know more about the rest of the work that we've done together with many other people.
Yeah. Well, thank you for sharing that in both the white paper and today in the webinar. There are a lot of comments coming through about this being an excellent presentation. They appreciate sharing the real examples instead of just talking about some of these ideas conceptually. So I know that went really well. But yeah, we had 190 people on live. And I really appreciate everybody who attended from, I counted, at the beginning, 8 or 9 different countries. At least this is all very applicable in not just to healthcare, but different settings. So I'm glad we had such a great audience. And final thought, I'm glad we had such great presenters today. Didier, Rubino, Jen, Ashley, thank you both so much for doing this today.
Thank you, Mark.
Thank you.